everyone. This is Jamie Marboe Nichols, and I am the host of the Heart of Dentistry Podcast, where we take the ache out and put the heart back in to our dental profession. Please join me as I interview various guests who have opinions and also solutions to what is going on in our profession and helping us put the heart back in. Hello, everyone. This is Jamie Marboe Nichols with the Heart of Dentistry, where me and my guests, we take the ache out and put the heart back into our profession. And we are lucky enough to have part two with Kristin Evans, the PH in RDH, joining us. And she's going to give us some more information on osteoporosis and women's health. So thank you for joining us for part two. I appreciate it, Kristin.
Yeah, thanks, Jamie, for letting me do part two.
Yes, and we're going to just jump right in because you have so much knowledge and it's obvious that you have a lot of passion for it. And I want to make sure that we get as much information out there that we can. And I really want to encourage our listeners and viewers to get a hold of you. And especially with some of the things that we talked about in part one. One of the things was the age. Just a real quick recap. They need to get a baseline somewhere between, and there's three different ways to get to find this out. If you have osteoporosis or what your bone density number is, you got to have a baseline. And old news, old way of thinking is to wait until you're 65. It's somewhere between teenage years and age 30, right? So.
Yep.
They get the scan. That's the first step. So they have a baseline.
Mm-hmm.
What, in your opinion, because as you have mentioned, what is the next thing that you would suggest? Would it be wait till you get the scan results back and then do this? Or do this, set up this, and then put all of that information together? So go.
Yeah. So first off is the two standard of care scans are the DEXA or the REMS. Again, DEXA is probably going to be covered by insurance. REMS, there's very few of them in the US. CBCT scan is not acceptable as a diagnosis for osteoporosis.
Okay, that's good to clarify.
CBCT is a way that dental radiologists can screen when we take a CBCT scan. What I've heard from the dental radiologist is they say, I see osteoporosis and I tell the dentist in the thing, but I don't know what they do with it. So just so you know, dentistry will never be a diagnosis for osteoporosis.
Yes.
But we are amazing screeners. And that's what I want is education, screening, and monitoring.
Just like our oral cancer screenings that we do chairside.
We are the best.
It's a screening,
yeah.
Right?
And
then we send them to the specialist. So
it's exactly what we're doing. We are not, and I don't want dentists to think that they need to start diagnosing for systemic issues. Yes. So the DEXA, that's the first thing is to know, because we want to know where you are at. And then we can then do some education and some individualized things to see if we can monitor that and keep it, or if it's going to lower. Now, some of those things, again, we talked about is we're going to get on resistance training right away. We also are going to lower our inflammation, and we're going to try to get better sleep. These are all things that just help our immune system be better also, but they will absolutely help our bone growth. Getting adequate amounts of protein, fiber. Protein's huge, and because you got to build those muscles. And if you build the muscles, the bone will come. Because this is a disease that affects, by the way, 1 and 2 women over 50 who will fracture.
1 out of 2 women over the age of 50.
And I want to put that in perspective because we put so much emphasis on breast cancer, which is horrible, sad. But we have all these wear pink everywhere and this and that. And that affects 1 in 8. And we're talking about osteoporosis is 1 in 3. And 80% of these people, they can have a genetic biomarker, like I said. And if they have that, they're going to be more prone, or if they have a family, anybody that's a sibling or a parent with it, they're going to be more at risk.
I want to talk about that because you and I talked about this. And so I'm going to go through with the questions. The biomarker that I call it the genotype, I'm saying on 6. one in six, or number one and number six, are associated with a lot of things that have to do with periodontal disease that we talk about and we educate on all the time.
Mhm.
With the interleukin genotype 6, we also know that there's a lot of autoimmunes that are attached to that. And in that list is osteoporosis,
Mhm.
arthritis, lupus, osteoporosis, various cancers, periodontal disease. So is that one of the biomarkers, one of the interleukin 6 genotypes you're talking about, or are you talking about something totally different?
That one, but there's also a new marker that they have found several of them that they've been researching that you can do it through. By the way, guys, this is so exciting because salivary testing. Like
Yay!
you can do 23andMe, which was what I did, and they didn't have this, but they're adding these as we go to, hey, we found a genotype for this. So they're adding that. But I did it, I spit. It's a saliva test.
And you can
And
do it at
this
home.
you can do it at home. You can do it we can do it in our clinic with our
Please, yeah, I
patient's
did it
care
in the
site.
clinic oral DNA testing and found out that I
Absolutely.
had the high marker of interleukin 6 genotype, which I already knew because
Yeah.
diabetes runs in my family,
Yep.
osteoporosis, lupus, arthritis, and it's no wonder. So I got the genotype. So they rate you in this biomarker with early, moderate, or advanced? Is that how they tell
I
you?
have, truly, I don't know about which one in the salivary and what they do with the
Mine was considered
genotype.
high because I evidently got the genotype from both mom and dad. Thank
Yeah.
you, mom and
And I
dad.
think that depends on the test that you do as
Okay.
how they do that. Most of them will have a category to that. But
Okay.
one of the most surprising one that has just come out is a possibility of having a vitamin D, a gene that you don't absorb vitamin D. And
Wow.
so this is huge.
That
And
would be huge to
there's
know.
so many cool things coming out that we're learning. So again, I study every day. I'm learning every day, but there's a chance that we could find that somebody's vitamin D, like they may be deficient, but giving them a lot of vitamin D, they're never going to absorb it. Vitamin D is a key part. By the way, everything that's periodontal risk factors that we know, smoking, alcohol, even drug use, any inflammation, autoimmune. These are all things that are going to aging. Those are things that are going to drive periodontal disease too. And
Yeah.
all the inflammatory conditions that we have, chronic inflammatory conditions, they all drive that. But the key factors that are at play with osteoporosis specifically is hormones. And that
Hmm.
for men, 1 in 4 men, because they have low T, and for women, because of over 50, 1 in 2, many times it's from low estrogen. And
So
estrogen
men, the
is the
stats
prime
with osteoporosis are one in how many for men?
1 in 4,
Four. And with women, it's one in
one
two.
in
And
two.
it has to do with hormones directly.
A lot
Now,
of it, a lot of it.
so they get the scan, they could
Hmm.
start the resistant exercising, and
Hmm.
then they would get some blood tests done, specifically asking the doctor to check what?
Absolutely.
What
So
would
their
they want checked?
doctors, yeah, so their doctors would be great to have a hormone test to see if you're low on estrogen. Um, is that just perimenopause and menopausal women? No, but there's a huge group in that. But
Hmm.
you can be low estrogen with PC or an estrogen imbalance or hormone imbalance with PCOS. Anybody that's has insulin resistance, so anybody
Hmm.
struggling with diabetes is also going to be at risk for osteoporosis because of insulin, which is a hormone, and vitamin D is a hormone, and
Hmm.
progesterone's a hormone,
And
and
thyroid,
cortisol,
and you talked about the
thyroid,
thyroid.
and high stress cortisol. You guys, all of our hormones interact with each other. They affect our bone, absolutely affect our bone.
And so can you get tested for your cortisol levels too, then?
Yeah, cortisol levels, they're tough
Doesn't that
because
fluctuate?
yes. In fact, cortisol, I do education CEs for dental. So in my course, I teach on this. I tell people that cortisol gets a bad name, that we think we need to reduce cortisol and have a pill that, hey, we don't have any cortisol, but cortisol protects us as a fight or flight. And it also is needed to lower when to go to sleep and to get up in the morning. We need a rise in cortisol. But unfortunately, if we're not sleeping or we're having obstructive sleep apnea or having any kind of mouth breathing or hormone imbalance, hot flashes, those nocturnal
Yeah.
awakenings, they absolutely affect our bone.
Oh boy, I have to talk to my husband.
I know, for
Yeah,
sure.
you're affecting my sleeping, my cortisol levels because of it. Anyway, I'm joking. But I'm not.
Yeah,
Okay,
exactly.
you said something in part one that I really want us to finish on, and then the good news is
Okay.
we'll end on that. So you said that osteoporosis is a silent killer.
Yeah.
I want you to explain why you call it a silent killer. What is the of course, other than hurting or having thin bones, why is it the silent killer?
Yeah, because it creeps up on people without knowing.
How does it
Unless
kill
you,
them?
yeah, well, yeah, that's the killing part is sad. Um, right now, the stat in the US is that 80% of broken bones are not screened for osteoporosis. It takes sometimes 2 to 3 fractures before a woman or a man is tested for osteoporosis. And that is sad. And I've had patients come in that they broke a bone, and I said, "Did they test you?" And they're like, "No." And I'm like, because maybe there is a systemic bone issue. And so what happens is, especially as we age, if you have a significant bone fracture, which because your bones aren't healthy, and those bones make red blood cells, stem cells, they affect our immune system. They
Hmm.
carry all of the minerals. They also, unfortunately, hold toxins, which we could talk about another time. So with that, though, our bones are structurally, they're important for us. But if we break a bone, um, after a certain age, I think it's after 75, 80 years old, 30% of those people die in 1 year.
Hmm. My
So
mom broke her
it's a
hip and she died within 18 months.
so that's the issue we have is that a large bone fracture, like a hip, a femur, a
What about
spine,
your back? Yeah,
yep,
spine.
spine, those take a lot of energy and a lot of it, a body
The
uh,
brain is trying to fix
work.
it. It takes a lot, and then it can't
Takes a lot.
concentrate on other parts. It
Yeah,
just is seeing that you're sick in your
yeah.
bones all the time. So when I had my first back surgery at about age 52,
Mhm,
it was my L5 to my S1, and I have something called it's bone on bone,
mhm,
genetic, no, I can't remember what it's called. I've mentioned it to you before, but it's a disc dysplasia basically that
mhm. Yeah,
my disc, the soft stuff kind of dissipates and
yeah.
it goes away, and I'm bone on bone. But they also said my L5 was broken completely in half on both sides. He said if I didn't have nerves and muscles and stuff around there, he could have just taken it out like
Mm,
this. And I thought, oh, that's probably because when I fell and broke my legs when I was 14, I probably broke my back too, and they just didn't see it. But now I'm
mm,
starting to wonder if it's one of my slips on the ice,
mhm.
something that, and I just thought I'd get better, anyways. So the good news is one of the things that you talked about is that you had this and you found out at age 54. And you have been able to, through certain courses and specific things that you are doing. And it's a different, it's a way of life now for you. I'm sure it is.
A way of life.
You got, the good news is you got 10% of your density back in 1 year,
In 2 years.
2 years.
It
Okay.
takes time. It takes time. Yeah.
Yeah. But you can every year now, you can go get that scan done and find out where it was from the last scan, right?
Yes. And
Okay.
even if it stays the same, we're a winner, by the way,
It's better
guys.
than it going back down, right?
Absolutely. Yeah.
Okay. The last thing I want to ask you is you have said there is no osteoporosis specialists out there. So give us some good news and tell us where we need to find people that are up to date on this besides you, right? Because you're not going to write prescriptions. You're not going to ask for blood draws. You're not going to be able to give them those kind of answers. You're giving them education, but we need a professional to go to. Who would you suggest? Give us a list.
So this is where it is going to be really personal because it depends also on some of the other things that you're dealing with. If you are regular seeing an endocrinologist because you're having problems with thyroid, because you're having problems with hormone imbalance, then an endocrinologist may be someone that you go to. I just want to arm you with questions and with tests. Obviously, a hormone test is needed and regular. And I have some ideas with that I can personally talk to people about. But you've got to find someone that supports you. So that could be an endocrinologist. Primary care physicians, they try their hardest. I have a beautiful brother that is a primary care physician. They learn a lot from their drug reps because that's where they learn a lot. And they have to know so much. How do we expect that of someone to be an expert in everything?
Yeah.
One of the best is an orthopedic surgeon. However, they deal when you're broken. So you usually don't get to see an orthopedic surgeon until after. But if you do contact me, I have an orthopedic surgeon who's retired, who is on YouTube that I can get you guys to at least learn some education from. He is what I consider the expert right now, and probably one of the experts in the world, because he's dedicating everything he has to it. And that's who I study from. But yeah, it is I'm going to say this is why I'm doing my bone health advocacy program. It's a journey, and it's a journey that you need a handhold. And I needed a handhold, and I have a brother who's a doctor and a brother who's an orthopedic spine, and they held me, but I also needed more resources, and I found them because I really believe this is God's journey for me, and He wants me to help others. So.
Did you tell me a rheumatologist at one time too when we were talking?
Absolutely. If you are seeing a rheumatologist, they can also help. Again, there's not a specialist, so they kind of dabble in it.
Yeah.
The rheumatologist, because by the way, scoliosis, you're high risk for that. And anybody who has rheumatoid arthritis is at high risk for also.
Yeah. Which is the rheumatoid arthritis. They're usually seeing a rheumatologist. Great.
Yeah, exactly.
Hey, Kristin, is there any chance that you said that I want to arm you with questions to ask no matter who you go to? Is there a way because we'll have your website and or how to contact you. Is there a way that have you created like maybe a list of 5 questions to ask that maybe our listeners, because of listening to this, would go to your either LinkedIn or to your website when we list it so they could at least get started with those questions to ask the doctors?
Yeah. I do not have a list
You make one for me, a special request?
I did make one because I individualize it. And that's the reason is because am I treating someone that's, I have people that reach out to me all over the country because I've written articles in dental magazines about osteoporosis. And I'm one of the only people when you search osteoporosis in dentistry. So please read my articles. You can find my contact information. But I have people reach out to me, and some of them are 80 years old or 70. Some of them are worried about it at 40. There's going to be a huge gap between those of what I want.
Well, you are just a wealth of knowledge. I'm so glad that our worlds have collided in a good way. And I am absolutely taking this. It's a part of my journey for 2026. It's a part of my New Year's resolution. And I'm going to start real soon here with all of the advice you give me. And you've given me a ton, so I appreciate it. So listeners, never too late. It's never too early. Get a hold of Kristin Evans, and we will probably have you back on in the next little bit.
I would love it.
We'll see. You let me know, okay?
Oh, yeah, for sure. We can do it.
Thank you, everyone. Have a great day. And here comes 2026.
Thanks, Jamie.
The Heart of Dentistry Podcast, where we take the ache out and put the heart back in to our dental profession.